Thank you for your time and listening to this summary video about our study titled Intrapartum Amnioinfusion Reduces Meconium Aspiration Syndrome and Improves Neonatal Outcomes in Patients with Meconium-Stained Fluid, a Systematic Review and Meta-Analysis. About 15 years ago, the routine use of amnioinfusion for meconium-stained amniotic fluid began to fall out of favor after the publication of a large randomized controlled trial followed by a meta-analysis. This randomized controlled trial concluded that amnioinfusion did not reduce the risk of moderate or severe meconium aspiration syndrome, perinatal death, and other major neonatal or maternal complications. The following meta-analysis was published as an updated review after the large multi-center trial by the same authors. It found similar results to the randomized control trial when the data was stratified by type of peripartum surveillance. However, some concerns have been expressed by experts about the methodology and conclusions of these studies. For example, in the randomized control trial, the level of care was highly variable among the included centers, and approximately 22% of patients randomized to the amnioinfusion group did not undergo amnioinfusion or it was performed incorrectly. In terms of the meta-analysis, it excluded 3 trials that have been included in previous meta-analyses. It is important to note that when these studies are included in the analysis, that the results show a significant reduction in meconium aspiration syndrome regardless of type of peripartum surveillance. In addition, since these publications, several more randomized controlled trials have been conducted, and so this study sought to reappraise the value of amnioinfusion for the indication of meconium-stained amniotic fluid given its association with serious neonatal outcomes. So let's review meconium-stained amniotic fluid and meconium aspiration syndrome. Meconium-stained amniotic fluid occurs in 1 of 7 pregnancies, accounting for approximately 400 to 600,000 deliveries in the United States per year. The incidence rises as gestational age increases, and it's seen in up to 27% of post-term pregnancies. Approximately 20 to 30% of neonates born with meconium-stained fluid will demonstrate respiratory and neurologic depression at birth. Meconium aspiration syndrome is defined as a respiratory distress in an infant born through meconium-stained fluid whose symptoms cannot otherwise be explained. It affects about 5% of neonates with meconium-stained fluid and has a high case fatality rate of about 12%. The pathophysiology of meconium aspiration syndrome is complex and has long been debated. Traditionally, it has been theorized that meconium aspiration syndrome occurs when meconium is aspirated during fetal gasping or during the first few breaths after birth. However, critics hypothesize that meconium aspiration syndrome actually results from chronic in utero pathology such as prolonged asphyxia and infection. The consistency of meconium may play a role in determining the validity of these two hypotheses and contribute to meconium aspiration syndrome's multifactorial pathogenesis. While thin meconium is associated with chronic hypoxic stress, acute hypoxic stress and inflammation results in thick meconium. We propose that amnioinfusion can have beneficial effects by diluting the meconium in the amniotic fluid. This dilutional effect may improve neonatal outcomes by attenuating the acute event of thick meconium. We performed an extensive literature search to identify randomized controlled trials that evaluated the effect of amnioinfusion on adverse maternal and neonatal outcomes for the indication of meconium-stained amniotic fluid. Initially, 1,249 studies were identified from databases in the gray literature. After initial screening and removal of duplicate studies, 34 studies remained. We excluded an additional 10 studies after full text review, which is summarized in the diagram on the side. Ultimately, a total of 24 randomized controlled trials with 5,994 participants, 2,906 treated, 3,078 controls, met inclusion criteria. 2 reviewers then independently abstracted data and assigned modified JODAD scores to assess study quality. A score less than 5 was considered high risk for study bias, and a score of 5 or higher was considered low risk for study bias. Meconium aspiration syndrome was the primary investigated outcome. Secondary outcomes were meconium below the cords, Apgar scores less than 7 at 5 minutes, neonatal intensive care unit admission, neonatal acidosis, cesarean delivery for fetal heart rate abnormalities, and postpartum endometritis. We calculated odds ratios with 95% confidence intervals for investigated outcomes. We found that prophylactic amnioinfusion used for the indication of meconium-stained amniotic fluid significantly reduced meconium aspiration syndrome by about 67%. After meta-regression and subgroup analyses, these findings were not significantly impacted by country, JODAD score, meconium consistency, or type of intrapartum surveillance. Amnioinfusion was associated with a significant reduction in all secondary outcomes, with the exception of postpartum endometritis. A leave when out analysis was performed for all outcomes, and our overall findings did not change. Here is a forest plot demonstrating the effect of amnioinfusion on the primary outcome of meconium aspiration syndrome. It shows that the effect estimates for all but 2 studies showed a decrease in meconium aspiration syndrome with amnioinfusion use. The diamond at the bottom shows a significant pooled effect. This is a cumulative forest plot for meconium aspiration syndrome. It demonstrates that cumulative evidence since 1994 has shown a significant reduction in meconium aspiration syndrome with intrapartum amnioinfusion use. This table shows the calculated pooled odds ratios for the investigated outcomes. Again, it shows that amnioinfusion was associated with a significant reduction in all outcomes except for postpartum endometritis. This includes an approximately 63% decrease in NICU admissions and an approximately 40% reduction in cesarean delivery rate. However, it is important to note that there is significant heterogeneity for most of the investigated outcomes. Some of this can be attributed to study size, intervention specifics, and baseline differences between study participants. Even after a comprehensive literature search, our funnel plot for the primary outcome demonstrated concern for publication bias. To account for the publication bias, a trim and fill method was performed, which is shown on the right of the slide. After performing the trim and fill method, the adjusted odds ratio of 0.41 for meconium aspiration syndrome continued to indicate a significant reduction with amnioinfusion use. Our study has several strengths and limitations. Strengths include a comprehensive literature search, the inclusion of twice as many studies as the previous meta-analysis for a total of almost 6,000 subjects, the use of the well-established modified JODAD score for study quality analysis, the performance of a sequential leave when out analysis that did not influence the significance of results, meta-regression and subgroup analyses that did not significantly impact the results of the primary outcome, and a high fragility index score of 39. Limitations include significant heterogeneity and publication bias for most of the investigated outcomes, variable diagnostic criteria for meconium aspiration syndrome between studies, variable amnioinfusion protocols, and the complications associated with amnioinfusion were not investigated in this study. What does this add to what is known? Amnioinfusion is a simple procedure that is frequently used by obstetricians for suspected umbilical cord compression to reduce variable fetal heart rate decelerations and the likelihood of cesarean delivery. With this updated and comprehensive review, obstetricians should reconsider amnioinfusion in patients with intrapartum meconium-stained amniotic fluid. Thank you for listening.